divided into four segments. Firstly, we are celebrating the first anniversary of the commissioning of the permanent sites, and we are also celebrating the final relocation of the clinical units to the permanent site today. So it's a double celebration for us, the anniversary of the commissioning, and of course, more importantly, we are celebrating that we were able to relocate all the units, all the clinical units in the teaching hospital to this particular point. Again, we are celebrating the maiden visit of our hard-working minister, the Honorable Co-ordinating Minister of Health and Social Welfare, Professor Muhammed Ali Pate, CON, to our facility. During his visit, like we have asked him and we have requested of him to please find favor, let's find favor on your side and have the pleasure of you commissioning some of our projects and honoring some of these our awardees today. I'm sure you're going to do that for us. This is a federal institution under the presidency being represented here by you. So we have to tell you, you've seen what we are doing, but we also have to let you know some of the areas where it is pinching us. The first area we will mention today will be the area of, I know people want me to talk about the infrastructure. No, it's a human resource challenge that we're going to have here, and it's of a big concern to us. At the road side that is 300 bed, we're already challenged by the inadequate number of medical care personnel occasioned by the current Japa syndrome. Now we are moving over to a facility that is 2,000 bed capacity. And so we are at a loss how to cope. We could not open our medical ward, a section of that medical ward. At the old side, our medical ward is about 20 beds, both female and medical. So it's a total of 40 beds. But here, the medical ward is 240 beds. So you have two sections, 120 beds, 120 beds. And then the challenge becomes, how do you run this ward? And so, even when you've commissioned the ward now, we cannot run it because we don't have adequate number of staff to do that. We had applied for waiver at the ministry. We requested for 500, which was our approved establishment. We are going to come to you, sir, with an additional request of at least 1,000 medical staff to nip at it, not even to solve it completely. I know you. So I trust that when we come, you'll be able to oblige us. Another challenge we have here is, of course, the infrastructure. Yes, we've established the infrastructure, so we've done the buildings, but we know, I'm sure you know more than I do, that buildings do not transform to quality healthcare. There are other things, equipment, furnitures, and all that. Again, we'll be approaching you to help us sort out some of the equipment, to help us operationalize those places.
Building roads here, but also the private sector and captains of industry. We have seen the exemplary behavior of Sir Emeka Ofo, Dr. Cletus Ibeto and others who have contributed, put their wealth in investing in health. Health is wealth. Without health, you can't trade, you can't do business, you can't go to farm, you can't go to school, you can't work. So health is wealth. And that is why the President is prioritizing investing in health and doing so in collaboration with all members of our society. Because together, we can improve this country. Despite the difficulties that we're going through as a country, we're very grateful that God, in His wisdom, has placed in the saddle His Excellency President Bola Ahmed Tinubu to provided steady leadership through this crisis that we're going. So I want to thank the good people of Anambra State for all the warmth since we came, the welcome here by all segments of society to support this effort of this great hospital named after a great Nigerian. So thank you very much, and I congratulate everyone in this community for this great step, and commit ourselves from the federal government under the leadership of the President that will continue to move forward to invest in health